what they found with this one, and what we've covered in other studies, let me shift my camera here, is that this is another U-shaped curve. Basically, on either extreme end of very, very sedentary and extremely active, you seem to have an increased risk of developing knee osteoarthritis, or at least the signs of knee osteoarthritis. And that is at least somewhat self-explanatory, because on the sedentary side, you're not using it, it's not getting robust, you're not getting hydration to the tissues, you're not building additional structures and adaptations in the knee joint itself to allow for a healthy aging process. And then on the other side, you may be moving so much that your body wants to adapt to it, but doesn't have the materials such as nutrition, substrates, and time to recover from that, and it will adapt in this arthritic change to basically patch up in the short term what it has to do, because your brain and your body are always triaging, they're always adapting. Like what does your body need to do with the resources at hand for the task? And so with the extreme end, where you're moving a whole bunch with minimal time for recovery, that could also basically make your body start adapting in these typical osteoarthritic changes to patch up what it has to do in the now, without having to think, oh, what is my knee going to look like in 20 years? It doesn't care. It's like, what does it need to do right now to accommodate for this level of activity? Now, it must be said that in this study, the average age was a little bit higher, with the age being about 63, 64 years of age, but still worthwhile to consider these adaptation changes. Now, in that middle of the U-curve is kind of that sweet spot, the Goldilocks, where it's not too little, not too much. You have just enough activity to stay fit, stay healthy, let the body respond, and then recover from that level of activity. So the conclusion basically is the moderate level of activity may be protective against knee osteoarthritis progression, while the low and high levels may increase risk. And that's my understanding, at least as of right now in 2025, and my hunch as to why.